Transportation and health, two words rarely used together. But how does transportation connect to public health? Surprisingly, in many ways. Vehicle emissions are a major contributor to air pollution and can have serious health impacts, especially for children, the elderly, and those with respiratory conditions. Each year in Oregon, we spend over $400 million on asthma-related medical costs. How efficiently our transportation system works can have a large influence on air quality and healthcare costs.
ODOT's interest in health started just a couple of years ago. In large part, our commission has a great interest in the connection between health and transportation. Certainly our governor has an interest in between health and transportation, but it really does stem for a variety of reasons. There's a lot of linkages to the various things that we do. Certainly safety. Clearly one of our concerns is reducing deaths and fatalities on our highways, so this gives us some opportunities there. Active transportation, getting everybody more active in what they do, giving them choices around how they get through the transportation system. So there's a whole variety of reasons why transportation and health are linked. And in a lot of respects, it's very similar to the work that we do for a lot of other aspects of the linkages in transportation. When we think about freight, when we think about the environment. So this is just one of the other key attributes that we need to be thinking about when we think about the transportation system as a whole.
In the 5-year period between 2009 and 2013, an average of 300 Oregonians died each year in traffic crashes. Of those killed, nearly 1/5 were pedestrians or bicyclists. ODOT and other transportation agencies are working hard to improve these statistics and eliminate traffic fatalities.
So the pieces of our Transportation Safety Action Plan include, first of all, an assessment of our roadway system in terms of looking at the safety. And we focus primarily on fatal and serious injury crashes. And for this plan, we actually looked at the whole county. So it wasn't just county roads. We looked at state highways, city roads, because the Safety Action Plan actually covers the entire county. Our top 3 crash factors that percolated to the top in our data included roadway departure crashes, aggressive driving crashes, and young drivers. So even just reducing those is really going to take a big bite out of those numbers of crashes that we see in the county.
Being safe and feeling safe are not the same. People are far less likely to walk or bike if they don't feel safe. As a result, they miss out on the health benefits of active transportation. Active transportation is allowing people of all ages and abilities to meet their travel needs without a car. Biking and walking help people meet recommended levels of physical activity. Biking and walking as part of a daily routine of getting places can be a powerful tool to reduce the risk of obesity and many diseases, including heart disease, diabetes, breast and colon cancer, and even depression. A convenient and connected network of bike paths, bike lanes, and sidewalks supports a more active and healthy population.
When we think about making the default option the healthy option in the transportation environment, there's of course some very easy options that we can think about. Seatbelt laws, helmet laws, airbags in vehicles. But there's also the built environment, so making communities more walkable, making it more convenient for individuals to bike to work, making it safer for individuals to bike to work, making it safer for individuals to walk around their community. This we know will increase physical activity, not just among young adults, but also among adults and children.
Being able to get around is important for everyone, but it can be a real challenge for older adults and people with disabilities, especially those who use canes, walkers, or wheelchairs. A complete network of sidewalks and access to transit helps people stay active, live independently, and connect with the services they need.
Vulnerable populations and mobility are another component of the way that public health and transportation networks intersect. So it's not just about giving people more options to be physically active, it's also making sure that vulnerable populations, the elderly, low-income populations, have access to health care. So if we don't have complete transportation networks, individuals who may be using public transportation, for example, may not have the ability to get from their home to their doctor.
Walking, biking, and public transit access helps support the economy and enable people to get to school, to work, and wherever they need to go. People earning less than $50,000 a year in the U.S. walk and bike to work at far higher rates than any other income bracket. Having good walking and biking networks, along with transit, helps people access jobs and opportunities critical to their livelihoods.
And they really look to us to give them the transportation options that they need in order to get to work, in order to get to the things that they need to do.
Physical inactivity has been shown to account for more than 11% of healthcare costs in the U.S. The good news is that 3/4 of Oregonians feel that healthy living is preferable to treating disease in our healthcare system. Making walking and biking convenient, safe, accessible, and socially acceptable is a good way for transportation options to support healthy living and reduce healthcare costs for all Oregonians. Preventing traffic-related deaths is a top priority for transportation, law enforcement, and health agencies. These overlapping interests can be seen in efforts to prevent impaired driving, to promote seatbelt and child safety seat use, and to use bicycle helmets. Many agencies are now working together on these issues.
And crashes are really our problem. And what I mean by our problem is it's me as an engineer, it's our partners in public health, it's our partners in law enforcement, and together I think we really can make a difference if we coordinate our work.
Obviously, safety is our #1 priority as an agency. So the linkage between the two of them allows us to move safety even that much farther.
This work isn't just happening at the state level. City, county, and tribal planners and public health practitioners are working together, coordinating efforts for a bigger impact. Public health practitioners are bringing new sources of data, evidence, and community perspectives to traditional transportation planning efforts. Recently, Clackamas County adopted an updated transportation safety action plan that, for the first time, incorporated health partners in the discussion.
Well, one of the partners that we begin to work with, and not quite being sure how it would turn out, is our public health side. And so for Clackamas County, as I've learned about the ties between transportation and health, I see that there's a very large piece of the puzzle that really involves health.
Communities throughout the state are finding opportunities for health and transportation agencies to work together. In Washington County, County Health Program Supervisor Amanda Garcia Snell sought out these opportunities to engage with local transportation partners.
Initially, when I had heard about the Lower Reedville project and this grant that our land use and transportation and housing folks were awarded, I reached out to them and said, hey, this is great. If you're interested in having us be involved, or whatever that might look like, let us know. And so they reached out to us to participate on their technical advisory committee for that livability study. They saw that as an area that needs improvement in terms of safety for active transportation and connectivity. There are not as many services there as there are in other areas, and so it's really an area that we know there are vulnerable populations, and they're having a harder time accessing healthcare and economic opportunities and healthy, fresh, affordable food. And so those are the types of things that public health likes to include in the conversation. And it seemed, to me anyway, that we're all really focused on some of the same outcomes, like reduced vehicle miles traveled. We are focused on those things for different reasons. And so public health really tries to bring the health side of that to the conversation.
The transportation choices we have can play a strong role in promoting public health. They give people options to breathe cleaner air, travel more safely, be physically active, stay independent longer, and increase access to jobs and education. Both transportation and public health professionals have a role to play in bringing all these pieces together.
What we've gained from working with ODOT is a richer and deeper understanding of how our two agencies and our two missions intersect, and how in many cases we are trying to achieve the same goals related to public health and public safety, just from a different angle or a different lens.
I think also as our society changes, right? whether it's getting our kids more involved in active transportation, or it's recognizing that as we all get older, me included, that I'm going to have different needs as I get older. Perhaps I'm not able to drive, perhaps I want to be able to live longer in my own home. Being more active and thinking about the linkage between the two of those will allow us to be successful.
So what are you doing to make a difference in your community? Our challenge to you is to have conversations in your community, work together, and then tell us about it. We want to know about your community efforts. Submit your stories, video clips, and photos describing what you're doing to improve the health and well-being of your community, and we'll post them on the ODOT OHA Transportation and Health webpage. Tell Oregon and the world what you are doing. See the website for details on how to submit your story. And thank you for your interest in improving Oregon's active transportation system.